Paul.
Yeah, welcome back. How you doing? Yeah, good
I
to
finally
see
find some stable connection.
Nice.
I think at the forefront of healthcare is focusing on the behavioral science, the behavior of human beings. We can honestly, all of us, whether in communities that have poor access or even high access, actually have healthcare in our own hands. So education and awareness and focusing on general wellness, and lifestyle is very important. Your diabetes, right, is for both poor and rich, and it's all lifestyle related. So we definitely try and focus on education and awareness as the key preventative measure to say, we don't want you in hospitals or sitting in a queue. We want you to take healthcare into your own hands. So let's go back to basics, basic nutrition, living a healthy lifestyle, getting sufficient exercise. Let's look at oral hygiene. So everything revolves mostly around health education and how to promote a healthy lifestyle in general. And that is what we focus on. Behavior is most important. Only very few diseases that are not linked to behavior, but most of the disease burdens that you find in communities amongst general population is very, very lifestyle related and related to behavior.
So how do you carry out that education? Do you do talks with communities, or do you provide literature for them to read? Do the people who you interact with, do they go to school? Do they read? That's a question, isn't it, for some communities?
I think the most important thing when figuring out a mode of communication is the language that the people speak.
Yeah.
Whether it be in South Africa or be somewhere in Sweden or Czechoslovakia, you've got to speak the language of the people. And it's always getting somebody who's relatable. So one, we ensure that with all the mobile pop-up clinics we have, we wouldn't carry one team around the different areas. We would always work with locals, simply because it makes it easier for the language and to get the dialect, you can have one language but spoken in different dialects. So one, we ensure that we speak a language that the people understand. Number two, it's got to be conversational. How much marketing material do you receive in the form of pamphlets? Again, I'll use a simple example like diabetes, where you walk into a pharmacy or read up on a magazine, but until you're diagnosed with it, half of the stuff you've ever read up on it, you've forgotten. But you're most likely to remember conversation like this podcast. On something that was said. So very conversational, so you can bring it to the level of the people and to make them understand. So community engagements are one of the key ways that we actually try and foster education and awareness and healthy relationships between healthcare professionals and healthcare promoters. So speaking the language of the people, bringing it down to their level, so that you can also share the experiences in terms of symptoms, because one area and another is very different in terms of how they would experience, say, perhaps a diarrhea outbreak. Some of the areas would be due to poor water and sanitation, and whereas in the others, because such a densely populated, could have been airborne. So only through in conversation do we also refine our material in terms of how we can communicate. We do have educational material and IC material that we would use. So reinforcement in the local clinics that would be within the area where you would have your posters, etc., educational material for schools. But for the general population, regardless of the levels of literacy, I think conversational is always the way that we try and engage with communities, regardless of and the literacy levels vary, right? So the people that we have at our clinics are not a set LSM or people who are within a certain literacy level. It's literally everyone, because about 98% of the South African population is dependent on the public healthcare infrastructure. Only 2% is on medical aid. So that 98% does encompass people who are literate, and who can read and write.
Yeah, it was just a question I had, because I'm completely unfamiliar with the areas that you're dealing with, and so I don't know like where the people would be, whether they would be in a city or rural areas, and whether they would go to school or not. So it's difficult for me to picture the kind of communities that you interact with.
I think it's only fair that we try and just paint the picture for you. So we provide access in urban, semi-urban, and rural. where the set criteria and our number one objective is to bridge the access to quality healthcare. So it could be in a city, and as I said, if you benchmark it against the stats that I've shared, if 98% depend on the public healthcare infrastructure, that gives us our diversity in the communities that we target. So it's very widespread. Obviously, the need in your typical rural communities is worse, but you can find, due to the dense population and as the population grows, where in a totally urban place, there's a need, simply because the current infrastructure was built a very long time ago. There isn't enough capacity, and as the population grows, that particular facility is no longer able to cater for everyone. Then you have congestion. And when there is congestion, then our pop-up clinics would serve as decongestion of those areas. And that's where we would meet an ordinary person who is literate, who belongs to maybe even an above average household, but they just happen not to be on medical aid, simply because private healthcare in South Africa is extremely expensive. You're looking at an average of a basic fare of 2,500 Rand for an entry-level membership with a medical aid. So to paint a picture, that would give you, there's what they call savings. So your savings would enable you to access your GP or your normal healthcare doctor, and that is about 3,000 Rand. And an average doctor costs 500 Rand per consultation. So which means with a contribution of 2,500 Rand over a 12-month period, you do the maths, it costs about 30,000. All you have is about 6 doctor consultations, excluding dispensing of basic medication. So it's something that's become extremely unaffordable, more so with COVID and people's jobs being cut and certain benefits being cut. So that's what actually leads to this overwhelming 98%, depending on public healthcare infrastructure.
So just to get a little bit more context, so the figures that you just gave me, how does that relate to the average salary that people would get? Like, they would be nowhere near able to reach that.
Near. You can imagine if an entry-level person, we're talking about unskilled labor, is even earning 2,500 Rand a month as a domestic worker, they definitely can't do that. If you look at a general admin position, say a receptionist, they would earn 6,000 Rand, so that already goes to half their salaries. So private healthcare is extremely, it's really not affordable, to be honest.
It's just not available, is it, at all?
It's not available at all.
Yeah. So what kind of, like when you do a pop-up, what's the process of creating one of these decongestive points for the system? Could you talk us through that?
Okay, so the process that we follow is normally working with the Department of Health, the Ministry of Health, because we're trying not to create a parallel process. I think our initiative is to complement what they're doing, because ours is obviously the intervention is based on resources, and the last thing you want is to have the community destitute beyond your resources and means that you provide within the intervention. So we always work recommended on the areas of needs that they have also highlighted other than what is known to us. So the first process is determining an area where there's either congestion in the nearest facility or the nearest facility, there's a proximity gap within the nearest facility where people have to travel for a very long time to get to the nearest clinic. So identifying that area based on that alone, access to quality healthcare where it's not within a close proximity or the local facility is congested. That's step number one. Step number two would be community engagement. I think when you deal with beneficiaries, it's always important to respect them and understand what they need, because that's our customer. And if they don't know that we're coming, they will not be able to access the service. So having a community buy-in is extremely important to us. So we would engage with the local councillors, local leadership, any civil society organizations that exist, churches, schools, where we would even tell them who we are. So we're not bringing a new clinic to the area. We are basically bringing a complementary service to what the Department of Health is doing, and we are working with them in partnership. So we go out with them in terms of introducing ourselves and having community engagement, because that also helps us understand what kind of services we need to bring. You cannot be bringing a dentist to an area where majority of the people have actually problems with their vision or
Yeah,
they don't
yeah.
have, you know what I'm saying?
Yeah, does it make
So
sense?
again,
Yeah.
those community engagers enable us to conduct a survey and know what the needs are on the ground. The third step would be what we call community mobilization, where the local agents that we've spoken to, whether it be an NGO, civil society, local authorities, would even go to an extent of even loud hailing to say, hey, on such and such a day, we are going to have a mobile pop-up clinic, so please come at this particular time. And we also know appropriate times, right, when to come, whether a weekend would be best if the average of the population is working, or during the week would work, or even going to a nearby school. And then the fourth step would be identifying the area. Where do we pop up? Because we literally just pop up. So if there is an area that the community can offer us a space, they would offer us a space. So whether it's at a local hall, or so that we can have it indoors. It's always best when it is indoors. However, if we do not have that structure, we would go with our gazebos. And boom, we then come up on that particular day and we would offer whichever rotation that we bring. But we always make sure that we always include a service where we could dispense basic medication, because again, screening alone is not comprehensive healthcare. You know, it's just making somebody aware of their problems and then leaving them hanging. So we do want to be in a position to provide them with basic medication and also be in a position to refer. And the partnership with government helps us to then responsibly handle the patient so that we can refer them for secondary healthcare, keep the healthcare data, keep record and track, and jointly work towards helping the patients.
That's amazing. So with all of that, what are the largest challenges for your organization when you guys have set up a pop-up, either indoors or outdoors? Do you have people who come along with conditions that you're not prepared for, like things that you can't handle, and then you have to move them on to get like emergency care or anything like that? Have you ever had an instance of that?
I'll be very honest. That is mostly very rare.
Okay.
Which actually makes me say with conviction that people need basic service. I mean, on the odd occasion, we've had to help deliver a baby, or somebody's blood pressure is so low that they have to go to the hospital and they're on the verge of a stroke. You know, that's very normal when it comes to the vitals. But in terms of emergency care that's related to any accidents or something of that nature, in the past 5 to 6 years, I can count on one hand those kind of emergencies. The emergencies that we would get would be untreated or undiagnosed disease that actually are bordering on case fatalities. And most often than not, we are able to at least stabilize the patient and administer some kind of step dose and then be able to get them to a hospital and so forth. So there's,
So the staff that you have on hand in the pop-ups, are they doctors or nurses or volunteers or?
So because our model is a for-profit model, so that we can have retained earnings to go beyond the intervention of a partner who's supported us, our staff is paid. So we have a wide variety of medical professionals that includes your registered nurses and your doctors. However, we do limit the usage of doctors simply because they are very expensive. So what we would have on site is a clinical nurse practitioner, which is widely used in South Africa in the public healthcare sector. The clinics have a doctor come by maybe once or twice a week, and they use your clinical nurse practitioner, who is certified to diagnose minor ailments at a primary healthcare level and has a dispensing license. And we have a telehealth platform that allows us to dial in a doctor for advice. You know, so I mean, what virtual is doing right now, you realize that it actually can be done. So the doctor's hands and eyes are actually the clinical nurse practitioner would say, feel there, is there a gland, is there so forth. So we are able to take a step up and be able to provide the patient with a doctor if needed. However, clinical nurse practitioners, most often not, I'll be very honest with you, are just as capable as your doctors, and if we need, we dial them in. But sometimes when we've got enough resources and fund, or we've got partnership with a local doctor who's even willing to volunteer their services, we use a doctor. But it generally, as a head count, comes in as very expensive for us to insist on physically having a general practitioner on site.
I didn't even think of the the ability to like zoom in or call in with the doctor and have them check that way. That makes total sense. Like we've been doing that here for the past 2 years with COVID. So it's exactly the same thing. Phone consultations constantly, or we have a service here called 111, Our emergency service is 999, so you would call those guys for an ambulance or like a medical emergency. You call 111 if something's happened but it's not quite an emergency, or if you don't feel well, and they diagnose you like over the phone, and then they recommend what the next step should be. So they have like a questionnaire on their end that goes through all of the different symptoms, and then they'll refer you either to your local doctor, or if the system's told them that it's bad, like they refer you to the local hospital, and then you can kind of queue jump a little bit, and because they're expecting you because you've been referred.
Exactly.
So yeah, similar sort of thing. Yeah, that's great.
COVID has actually helped us because we've been preaching this for the past 5-6 years, and the rest of the world didn't get it, right? How can you have telehealth consultations? How can it be virtual? But with COVID, it's proving exactly that even when you speak to your doctor, there's very few checks, especially when you've got your common ailments. Sometimes they don't even have to touch you and check vitals. You have a conversation with them, and you tell them what your symptoms are, and they prescribe.
Yeah,
and that need not be face to face. It's but COVID has really helped people understand exactly that.
Understand the modality of like how to do remote care in a way. Yeah,
exactly.
Just so I get your name right, is it Adi or Addy? Adi. Sorry, I have a friend over here. He spells his name the same as you, and we call him Adi.
It's just a different pronunciation. The English people say it Adi, but
So Adi, because you're new to the organization, has that enabled you to see like different challenges from almost like an outsider, a different perspective, or new knowledge that perhaps somebody who's embedded in it, like Tumi, has, maybe by working in it all the time, you get so close to your work that it helps to have somebody come in with a different point of view on things. Have you had any situations like that?
I think for me, coming in from a different angle, I hope I can complement the services that we offer, and through networking, connect to people where we can partner. So that is my primary goal. I love the idea. I love the concept. I think that it has so much potential for growth, and definitely COVID has shown us that pop-up clinics and vaccination sites can be made available in any kind of community. So people are now buying in on that idea. So it's much easier to sell the idea and the concept to people because they now understand what it means. So I think for me, I love the idea of making a social change and an impact in a community, and driving awareness and helping people. So the element of the organization having a footprint which can change people's lives, for me, is very impactful, and that is what's really exciting for me, to be part of this partnership.
Yeah. And so when was the company started again? You said it was early 2000s, was it? And were you a founder, Tumi?
Yes, so it started in 2015. And just, I'm sorry if you don't mind me going back to the question you just asked, Addie. So the real shocker for me as an outsider just coming into the space when we started the business was exactly what I shared with you a few minutes ago, to say if your eye is red, right? You'd walk in and buy yourself some eye drops.
Yeah.
And problem solved, unless it's something hectic that is an infection that you'd need to consult for. And for me to see how people would move from minor ailments to something serious simply because of not having access to care or even access to information or the means to even buy a simple solution to stop it. That was a real shocker for me when I would see young children, especially when their baby teeth, start decaying, some of them due to poor oral hygiene and so forth. You'd see a small baby who has an infection and would develop an abscess. You know, we would never let things get to that point simply because they didn't have access to medication. So for me, that was the real shocker. So yeah, the company was founded in 2015, and those were one of the things that shocked me, just landing into the space. I just thought the issue was just general congestion and maybe travel distance. You know, I didn't know that the situation was that dire. And for both, another shock was for both Black and white communities. When I founded this business, I thought it was a solution that would have been more appropriate for the Black people, and I resonated with that as well myself, you know, as being a Black African person living in South Africa. I had no idea that it affected everyone across different racial groups in our country.
Wow, that's amazing. And so because of that, like, having a condition like an abscess or something like that in a baby, that's the last thing you need. And then, you know, that's a really powerful example. So what brought you into this business? Like, you know, you came into it, you started this business, but what was it that triggered your interest or your passion that's driven you now here, like 7 years later?
So I studied law, and I'm a legal practitioner by profession. And I worked for an organization that was in the healthcare sector as a legal practitioner. And that was one of my first exposure into the healthcare sector, where the organization was funded to provide the US aid to basically do all the relief work for HIV and AIDS, including research. And that was the first time I was exposed to the healthcare sector and fell in love with it and felt that I needed to make a change. But in 2013, when I left formal employment to start a business and become an entrepreneur, I had a rude awakening when my savings were starting to run out and I no longer had medical aid. And I was sitting in a clinic for hours just to access basic health care. And I think that's the first time I had a need to say, something needs to be done. But it took a lot of thought to get to the current model where I knew that the people that I wanted to help don't have the money, the same way I didn't have the money at the time, so I couldn't make them pay. But I then decided I want a business that is going to have social impact, but that's also going to be sustainable. I already knew that I didn't want to go through the NGO route because the previous organization was partly an NGO, and I knew the nightmare of being donor dependent and how people were always wondering if their contracts would be renewed. And sometimes it wasn't even about the contracts, if the work that we're doing would be sustained and the people that we help. So I already knew, you know, that I just wanted to come up with a sustainable solution in the healthcare sector. And it evolved, I must say. I mean, it went from marketing and helping brands who actually have target groups. So I'll give you an example. One of our partners is Dettol, and they make the antibacterial soap, right? Yeah. And they by Ricky Benkiza. And I was giving them access to the public healthcare space to advertise our product. But then I had a light bulb moment to say these companies make a lot of money from the very same consumers. So for them to paint walls in a hospital or have a branded baby room is actually a futile exercise. Why don't we take that money that's spent on, you know, millions on branding and marketing and material and put it into purposeful marketing? And that's how the business evolved. And, you know, that's how I came to the model that I have. It's been chopped and changed numerous times, blood, sweat, and tears. Lots and lots of tears, and losing lots in getting to what we have now. But it was basically, how do we bring the haves and the have-nots to help, you know, the other people on the other side, and just create that bridge.
That's you know, for you to have that story that you experienced it, that's really powerful. And you know, that shows like the origin and where your understanding came from, because you were in that situation. And that's you know, to experience something firsthand, but then not to just sit back and wait for somebody else to do something about it, but to do it yourself. Like you deserve like a high commendation for, you know, for taking it from an idea or an inconvenience to an idea to then a solution that's going to benefit millions of people, like not only in South Africa, but in Botswana and in the other countries in the African nation, and maybe even elsewhere as well. You know, because although there's definitely a strong need in Africa, there's probably equal need like all around the world as well, in lots of different places. So, you know, if you found a model that that you've got that really works now, there's no reason that you couldn't expand upon that as long as you have those partnerships with those brands. Yeah, that's perfect. Really, really
Exactly. And the need, as you said, is just not in the African communities. You look in other countries like the US, where you have issues with doctor density. And, you know, having access to as many doctors. This model is replicable for any other community where there might not be too many doctors, cutting out on waiting times, and just coming up with solutions where you have people on that who could just log onto the telehealth platform and dial a doctor themselves, the same way you have 111.
Yeah.
It's exactly that, where it's bridging the access to quality healthcare. So 111 bridges that gap.
Yeah.
And it actually decongests your facilities. So instead of you walking in there for something minor and causing a long waiting time, you can dial in and, you know.
Yeah, they can sort of screen you beforehand to, you know, to make sure whether it is really bad or not.
Exactly.
Yeah, and then they also give you the option to go to different kinds of facilities. So either your doctor's surgery or a walk-in center is something that we have here. That's almost like a miniature hospital that you can access. Sort of, I think between like 7 or 8 a.m. and like 10 p.m., something like that. So it's not open as long as a hospital, and it has fewer facilities, but it's great to have a walk-in center because they have things like x-ray machines and, you know, they have like access to all sorts of things that a regular doctor's surgery doesn't have. So it's like an intermediary, like an in-between service. So yeah, walk-in centers are really good, and they remove the burden from the hospitals and from the doctor's surgeries in a lot of cases. Yes, as well. I think the requirement for healthcare, even here, is so high. Like, because we have an aging population, and we have like the elderly people. They have a lot of complex needs, and they take up a lot of time. And then you have, we did have very active youth who would, you know, go out and party and get in trouble and get drunk and injure each other by fighting or whatever else they would be doing, and they would be clogging up the emergency rooms as well. But I think since COVID, that kind of calmed down, which is like, that's one good thing about
thanks
COVID.
To the lockdowns.
Yeah, thanks to the lockdowns. Yeah, you know, there's been less fights through alcohol, which is
definitely
good.
And as well, here we have the same thing, where obviously that side you have a wider geriatric society with the elderly people. So our population is funny. So you have like an upside down triangle where you have at the top a lot of older people and few of the really young ones at the bottom. But ours is like an hourglass, right? Due to the scourge of HIV and AIDS, we have a lot of children. So we've got a very big pediatric society. And you'd have your middle-aged people less, so, you know, where the bottle gets smaller because most of them have succumbed to HIV and AIDS. So we've got a lot of childhood also and a lot of elderly people. So most of the people that do burden a healthcare facility is mostly mothers and children, and very young children, because our pediatric society is so big, and our geriatric society as well. And obviously with our middle-aged people becoming a smaller part of our population. And again, there you find the congestion, right? That's where the burden is.
So is HIV and AIDS like a massive problem even now, like still? Because we used to hear a lot about it years ago, but then you know, the awareness of these issues, like, it comes and goes like in waves, doesn't it? And it just depends whether you know, what sort of vogue in the media at the time, or what's being highlighted as a major issue. So news of AIDS and HIV and things like that in Africa is something that I haven't heard like for a long time in the media. I think we kind of hear about International AIDS Day on the 1st of December every year, because there's the charity you know, by Elton John. But I think that's about it. So is it still like an epidemic?
So I wouldn't say it's an epidemic. However, it remains a concern in this sense. So education and awareness, most people do know about it, and the disease is very well managed. And that is why we have so few case fatalities. So very few people die from it. However, what's becoming a concern, our sexual reproductive health, especially in our younger society, has become quite a concern because of the adults that are dying that we had in our hourglass in the middle. We have a lot of child-headed households or households that are managed by a geriatric society. And there becomes a lot of discipline in the overwhelming majority of the population, which does happen to be Black and previously disadvantaged. So you find more youth, although there is so much information, everybody knows what HIV and AIDS is. There's a concern around sexual reproductive health. And due to promiscuity that you probably have in your society as well around alcohol, drugs, and the partying.
Sure.
And the carelessness that just comes with them being irresponsible and intoxicated, and substance abuse being a cause of poor.
Yeah, I was going to say, or even just hormones, like
even just
without alcohol or drugs, literally just being young. It's like
just being young, right? We need to improve more on our youth-friendly services. So we still are getting, amazingly enough, which is still a shock, younger people being infected with HIV and AIDS. And one would expect with this amount of education awareness, access to free testing, if there's one thing that is easily accessible in South Africa is access to antiretroviral drugs, to HIV treatment, and to testing. So easy. You would walk anywhere in a township and find a random tent, either by WHO, Anova Health, USAID, testing that's available. Getting you an ART is this simple, it's that accessible. However, we are getting younger people being infected. So the rate of new infections among young people are growing. And I think, which is worrying. And although there's just so much, condoms are everywhere. In a simple bar, you could go to what we call tuck shops, like a little mini snack shop, and you'd find free condoms there. The youth are just not using them.
That was my next question. I was going to ask, are condoms readily available to everybody?
So my son is 12 years old, and I think he probably can have access to condoms.
Wow.
Because they're everywhere.
Yeah, without even question. Because there's a perception in the West that perhaps the Catholic Church is against that, because they're against the use of condoms because they want to promote the sort of the growth of the church in a way, which that's, I don't know if that's a false thing, but that's something that we hear over here. So
the funny thing is, in South Africa, when it comes to religion, right, you have your charismatic churches slowly taking over. Our churches that we formerly know, like your Methodist, your Anglican, and your Catholic church,
Pentecostal, kind of lots of singing and joyous atmosphere to be in.
So your charismatic churches are taking over, and they preach a lot of abstinence and no sex before marriage. And I'm not sure
that can be hard. That can be difficult. Especially if you see somebody that you like and you've got chemistry and you hit it off, it's going to be difficult to abstain, even if you have a really, really strong faith. That is a challenge for sure.
Yeah, so the churches here, like your Catholic church or your Anglican church, they don't impose so much on on some of those kind of beliefs, around procreation. However, there's a strong feeling against abortions. Whether people have a right to being mothers by choice or to have it by default. So again, in South Africa, termination services are very, very easily available. Yet we have a large number of backstreet abortions, and that still lead to case fatalities where young women die. Trying to do backstreet abortions or buying pills or drinking coke and mixing it with whatever. And again, religion has a lot to do with that, where young people do not feel confident enough or safe. We don't have a safe and enabling environment that allows women who do believe in not becoming mothers by default, to termination.
So do you think, is that something that your culture or your society is ready for, to to embrace pro-choice?
I think our society has embraced that completely.
Yeah.
You know, just seeing the number of abortion clinics and how government and the public healthcare system it does have free abortions, I think up until 20 weeks or so forth. There's both medical abortions and where you use the pill. Yeah, so I think our society is very open to pro-choice as it's there. It's just that some religious groups, even Islam as well, you know, actually make it harder for their congregants due to those beliefs.
Yeah. Wow, that is a challenge. Yeah, definitely. It's yeah. So what are the kind of difficulties are you able to overcome by providing this service? You know, what are the good rippling effects are there that by having your service, how does that how does that help in other not obvious ways? You know, there must be you know, like a knock-on effect. So one of your pop-ups goes in a place, the community comes together to receive the care, and then what, like, the people receive the care, and then how does that affect the community in a positive way? Do you have any examples?
So one of the knock-on effects that is just not expected and quite subtle is with the education and awareness. So say, for instance, you go into community and you do hand hygiene behavior change, you know, asking people to practice good hygiene habits.
Yeah.
And you also teach them about diarrhea, because you've got to explain are you pro proper hand hygiene habits. It's just explain to people that the majority of the diseases are caused by bacteria that we get, including your flu and so forth, that we pick up back with our hands and, you know, bring them to our noses or eyes from surfaces that we've touched and not washing our hands. And the funny thing is, as soon as you start that kind of education, you see an increase in the foot traffic in your other clinics, where people are now recognizing symptoms of diarrhea, where people normally believe that diarrhea is when you have a persistently you know, a high rate of going to the loo and having a runny tummy and having a very loose stool. But sometimes it's just in the frequency, going more than 2 times a day, having to, you know, is abnormal, especially when you haven't had any roughage or anything to stimulate your bowel like that, you know. And you see more people recognizing the symptoms of diarrhea, which shows that now your education and awareness is landing, because people are able to recognize the symptoms. They're presenting themselves at facilities, whether they are diagnosed with diarrhea or not. You know, there's a false alarm. You've driven awareness, and now people can identify the disease. But after that, what happens is you see a reduction in the number of people who present themselves in the facilities with it, because now they're practicing the solution that you gave them, which is proper hand hygiene practice. You then follow the statistics and you start looking at what happens in your secondary facilities, is that the number of reported cases in hospital have reduced. Eventually, the number of cases that lead to death have reduced. And it all started with what we do in the clinics. So those are the challenges we're able to overcome, where you have a larger number of people put on chronic medication for hypertension simply because they came to check their blood pressure with us, and we're aware that it was high, because sometimes, you know, those are silent killers, right? Like your high levels of cholesterol, because you're not aware of them, and sometimes you don't present any physical symptoms, only when your vitals are taken or a diagnostic test is taken. So those are the positives that we're able to see, how we can promote a generally healthy community and better management of most of the chronic diseases. And just from access to screening.
Yeah, and I was going to say, like, I guess that having a healthier community is going to give you a happier community as well, you know, because you're not going to have people who aren't able to go to work because they're ill, that you're going to have people who are able to support for their families by going to work, or being able to look after themselves and look after each other as well. So yeah, just such a basic thing like education on washing hands could have a massive impact on a community. Yeah, and how people feel as well. Like, you know, maybe they'll be a bit nicer to one another as well. Like, because I know if you're in pain, you don't want to be nice to anybody, do you?
And just general mental health, right, Paul, as something that we take for granted in our societies. And again, it's something that goes across the board. We are going into having more depressed communities, you know, and both across different racial groups, you know, where people are not able to recognize themselves when they are depressed. People are angry, people are upset, people have got childhood trauma, and again, introducing that into our clinics, because that's sometimes the cause of domestic violence, the cause of substance abuse, you know, so many different forms of abuse, including bullying in schools, including just people giving each other a hard time at work. I see it even in corporate, right? With people who are in good jobs, where people bully each other, people just enjoy putting other people down. And it just has a lot to do with people's emotional health and their surroundings. And I think health to me is holistic like that, right? A healthy mind, a healthy body. And, you know, it's not known just for kids, including adults too. That are we in creating enabling safe spaces, good, healthy work environments? Because some of us are grumpy from home, right? We're in chronic pain and you get to work and you clap out on all your staff. And maybe it's because you are in some kind of pain. So emotional and mental health wellness is extremely important in our societies, because that's what causes your hypertension as well. Your blood pressure goes up. And it's very much linked to your mental health as well.
Have you seen an increase in mental health issues, like in a period of time, 10, 20 years, or specifically the past 2 years? Because
the past pandemic? 2 years, we've seen an increase, and more so in the, what we would say, higher LSM, you know, in a country where your household incomes that earn more. So you more from your average to your high income earners. The people in low income, I guess, at some point you get used to poverty, right? And it stresses you less. But we've seen with the increased loss of jobs, the pressure that we even have on ourselves due to social media. So we see in your average income earners, in your upper class, where, you know, a lot of us is very social as well. We see a generally very stressed workforce, because we also do employee health. So where companies don't actually contribute to private healthcare, they would call us to do employee wellness. And it is just crazy how the workforce is generally very stressed, you know, and they're not aware of it. And that actually leads to poor productivity. It increases absenteeism. So again, one of the challenges we overcome with our clinics is when a company deploys us to do their employee wellness, you do see over time increased productivity, because we're able to even you know, stop them from actually missing out on work by bringing the healthcare services to themselves. We're able to help people to make lifestyle changes. And sometimes having a conversation with the employer that you have a stressed workforce. Are there other interventions that you could have to get into the source of your problem and increasing employee wellness, which is also holistic and linked to your profits as well? Because if people are unhappy, they're not going to work.
Yeah. And just quickly going back to when you said that perhaps people who are in poverty, they get used to that sort of stress, or they build up their tolerance or resistance. A phrase that I've heard is that basically when you're in that situation and your major concern is where you're going to get food from, you know, that's your focus. And that's why you have people who are in semi-comfortable or comfortable situations who then have the time to relax and reflect and think, oh, where am I? What's going on? What's my situation? And that's when doubt and depression and things like that can kick in. But when you're in like a poverty-stricken situation, you only care about the basics, like shelter, food, and safety and stuff like that. So it's, you know, you probably you are affected by mental health issues, but that's not the priority. The priority in those times there. Yeah, that's. I had something else I was going to say, but I think I've lost
food
it now.
Security. Funny enough, people would have an assumption, right, that you know, in Africa, let's talk in the context of South Africa, which is kind of first world in Africa, right? We do have food security issues, but because of the basic income grant that we have, which has really helped our society, as much as we would still have communities that go hungry, in inverted commas, but the situation has largely improved over the past couple of years, and with our government implementing the basic income grant, where, you know, at least that 350 rand that a family has got access to allows them to live within the breadline, you know, which is around 10, 20 rand, so they can get by. So the levels of poverty and hunger have decreased on a certain level based on the perception that the world has of South Africa as a country. And we've realized the needs in our communities have sort of shifted away from hunger.
I wasn't specifically saying that like hunger would be an issue in South Africa. It was just that when you are poor, like when you do struggle to pay basic utilities, even then, like just trying to get money for anything is your priority.
Definitely.
I don't want
and we've got informal settlements, Paul. I don't know if you've ever seen the shacks and the informal settlements that we have. So people basically take it upon themselves to use and have basic utilities for free. So they then have access to free electricity, not through legal means, illegal means. And I guess maybe that's why they're so chilled at times, because they're pulling electricity from the street lamps, have access to water. It's slowly getting better, but where it gets really bad is informal settlements that don't have basic services, where they don't have flushing toilets. And that's where the healthcare needs become so great, because you have the environmental health becoming an issue, because that poses a risk. So the issue there is no longer just general access. There's an environmental health risk due to poor water and sanitation. And it's just so amazing how poverty-stricken society have reached levels of depression where they have become completely paralyzed. Just living in those situations where they've just learned to live with it and think it's okay, and it makes them lose ambition and they lose hope. And with the amount of, the rate of unemployment is so high. You can sit with 3-4 degrees in our country without employment. COVID has made it worse, I myself wouldn't, I wouldn't have so many employment opportunities, despite the fact that I'm an entrepreneur, I'm exposed, I'm educated, but I could sit, So what even drives most South Africans to entrepreneurship is due to the high rate of unemployment. I'll be honest, one of the reasons for starting the business was, over and above my experience, is just accepting that to get back to formal employment is not that easy. So if you can't get employed by someone, employ yourself. Yeah.
And do you think you spoke of the sort of paralysis, or the situation where those people in those situations, they find that they just accept it over time? Is that just simply because of the size of the challenge that they have ahead of them? That like, say for example, if I had to go and climb a mountain and I didn't have any equipment, but my life depended on climbing that mountain, I might be inclined to just stay where I am. Is that like a good metaphor for the situation, that climbing out of where they are is just too difficult? Like they can't make it into what like you or I or Adi would regard as like normal living circumstances, because it's just too difficult for them to get there, so they don't even try.
No, definitely. Paul, Adi, did you get that?
Yeah, I did. Sorry, I was just trying to get the dog quiet.
What kind of dog have you got?
It's a pit bull.
Oh, right. Nice.
So he was making a lot of noise.
Yeah. He can probably hear my voice and he's like, who's that? I'm like, yeah. That's all right. I was just saying that sometimes when people are in that poor position, that to get out of that is too difficult for them to try and go over that hill, so they don't even bother. They don't see a way out. They don't have the sort of citizens' advice or the support structure in place to enable them to move from a sort of a shanty town to a normal sort of environment. Yeah, how do you fix that? Like that's an insane social issue.
We have a long way to go, Paul, and I think government is the biggest buyer in our country, and the only person that has, the organization that has the power to solve that is government. We can only do so much, but government is the biggest buyer. And government is, with the taxes, they're the only ones who can fix that. We all can only do so much. And again, it really, really affects it, because you find those younger people who are just so paralyzed, who don't even want to move out of the shanty towns or even take the next step. It discourages other younger people who are still at school, who start feeling, not to carry on school. We saw that during COVID, that there were a lot of dropouts in COVID, where, the circumstances by COVID were just making it even easier for them to drop out, because going to school was already a challenge. And I honestly think the government, in our case, we can only do so much as a society, but we need our government to do that for us.
Yeah, we had a similar thing here. We had an increase in dropouts, in college rather than school, because here education is mandatory till you're 18. So you have to go to either school or a college till you're 18 by law. But yeah, definitely a lot of people not completing their courses, or finding it difficult to transition from being in their bedroom for a whole year to coming back into the classroom, because they became socially isolated, and they became afraid of the outdoors, and they became afraid of other people, and the fear of the virus or interacting with other people, or it just paralyzed them. So yeah, some people never came back to college.
Wow.
Yeah.
Wow. If I may ask you, Paul, how does your government manage to make it mandatory and make it legal? How do they enforce staying in school until you're 18?
Well, they put it into law. They wrote it into law, and then I think they do it by fine. Like, so if a child is not in education until they're 18, they have to be in some form of education. So they're not even really, I don't think, allowed to work a full-time job. They can work part-time, but they have to have education or full-time education until they're 18. And then once they turn 18, it's up to them what they do. They can continue with education, or they can go and get a full-time job, or they can join a military service or something like that. But yeah, I think I'm not sure if they find the parents, but there's some sort of disciplinary procedure in place.
Okay.
Where, yeah, it's all linked to like local councils. So we have like central government make the laws for the whole country, and then you have local councils that also have they enforce like the central government laws and local ordinances and stuff like that. So yeah, there's a sort of a strict reporting system. So if somebody went missing off the books, and they would have to find a way to support themselves,
Okay.
living off their parents or something. But yeah, it's frowned upon. But
Okay.
it's only the past couple of years that it's been that way. Like when I was that age, like I left school at 16, so it's only been the past couple of years that it's been 18.
Okay.
Yeah.
Okay. Very interesting. Very, very interesting.
So yeah, go ahead.
So no, what I was going to say, we were talking about social isolation and the challenges COVID has brought along in terms of mental health and wellness is quite high. So it's affected a large population, not only the youth or your young children, but also the elderly, because they've been locked up in old age homes and not having access to see their families or access to engage with people. So the depression, the mental the effects of COVID have had a huge impact in our communities, and that whole aspect of social isolation is something one can talk about a lot, because it really has affected the health and well-being of people globally, I think.
Yeah, I definitely agree, and I don't think that when I say the governments, that they really understood that that would be a consequence of lockdowns, how much we actually rely on each other and our small interactions, whether it's, you know, you're an older person going to a bank or to a shop or down the local pub or, you know, or cafe or whatever. When you take all of those social connections out of people's lives and you stop people from, you know, doing their normal day-to-day thing, going to the gym or going to the park, it's like, it's really detrimental. And the other thing, the next big issue that they're having to deal with, and I heard this on a different podcast, I think it was the Joe Rogan podcast, was the effect on children's development, because they're having to wear masks and their teachers are perhaps wearing masks as well in classrooms. So they don't know how to pronounce certain words because they rely a lot on looking at how other people move their mouth for, you know, to learn these words, or, you know, for basic gestures of body language. They've completely missed that over the past 2 years, and they're not sure how that has impacted them or stunted their sort of emotional, social development.
Also play.
Interesting.
Play. Play is also something that has affected children. Children just don't know how to play anymore.
That's how they learn as well, you know. So if they can't play, then maybe they can't even learn. Like, it's affected everything. So we've done this now. Are you ladies good for time? Or you're okay? Do you have more you have more to say about your projects? You can I'm happy to keep going if you want to, or if there's any messages that you'd like to get out to any potential viewers or people who could help your enterprise.
Definitely, thanks for that opportunity, Paul. So we work on a business to business model, right? So where we approach private sector to say, can you partner with us on impact investment? Because this is really about impact and how we can actually see how far your money can go, and we can actually drill it down to saving a life. We are in constant need of partnering with organizations based on their values or their mission-related investments, or not only carrying out their corporate social investment, but even carrying out the company's impact initiatives that they might have, where they want to invest in the healthcare sector and have a return on investment. So, and in our country, social entrepreneurship is still relatively new. People are used to the more commonly known model of social entrepreneurship, which is more around the NGOs, and which doesn't even have an entrepreneurship part of it, right? It's partly social. And people don't understand how you can have an organization that is for profit and with a social cause. They just expect you to be a non-governmental organization, no profit. However, from a sustainability perspective, it is key to be able to generate revenue and have retained earnings so that you can carry on your work. So our business profit is secondary to us, right? What's primary is reach. What's primary is having the numbers and scaling. And the only way we are able to have more retained earnings to help even more communities is through being able to do more work. So I'll give you an example. We service up to 200 patients in a day in one particular pop-up clinic. Now, the more pop-up clinics we have opens it up for us to have buying power of basic medication. So buying 1,000 tablets versus 10,000 tablets, you already get the benefit of a bulk purchase, right? Having more than one mobile unit, you get the benefit because we work on a per day model. You know, what in a hospital, I heard a hospital is a per day model. The hospital focuses on having the number of patients, the number of staff needed to run the hospital, regardless of the number of patients who are actually in the hospital that day, so it's having their gym, and that's how we work. So if we have more patients to see, we can even maximize our resources and our staff, where they can run 2 mobile units by one team, where they can go half the day here and half the day there, because we're actually able to get through lots of numbers in one day. And what we're always short of is the resources to do it, and we always try and make it mutually beneficial. So I'll give you an example. By one of our clients, Dettol, having the Dettol mobile pop-up clinics, that's actually free advertising for them, because the people that buy the soap are actually within that income group. Those are the buyers of their soap. Somebody like you and I, we are able to compare. We get onto the shelves, we start comparing, we see prices. That one's got aloe vera and so forth. Those people have got what normally rely on brand power. So where in South Africa, I'm not sure if it happens in your country, but something as simple as that antibacterial soap, we wouldn't refer to it as, we would give it to the lead brand that's popularly known. So something like an antibacterial soap is called a Dettol. Anything like a pair of diapers, so the leading brand would have the, so in the black consumer market, a pair of diapers, one of the leading companies is Kimberly Clark with their brand Pampers. Not Kimberly Clark, sorry, P&G or Kimberly Clark's Huggies. We would call a pair of diapers Huggies instead of a disposable nappy. Toothpaste, for instance, Colgate is a leading brand. So when I grew up, I never knew toothpaste was toothpaste until I was a certain age. It was just Colgate, you know, so toothpaste. And, you know, so for those brands, when they do partner with us, that's the return on investment, the buying power. Insurance companies as well, it would give them access to reach in those higher LSMs that can actually buy the insurance. So if they see an Old Mutual, which is an insurance company, branded, they're most likely to buy more of that insurance because they see it as somebody who gives back to them as a community. So we're always looking at, you know, your international markets, because they do have footprints even in our country, you know, to say, please help us. Your commitment and your impact investment need not cover us for an entire project. Even a simple pop-up clinic, you know, for less than 20,000 Rand, I'm not too sure conversion how much that would be, but we can service up to 200 patients. So for less than $1, we can actually see, or even £1, see one patient and dispense basic medication to them. So we're desperately looking for partners who would partner with us, but, you know, the values aligned, and we would want to also give them a return on their investment based on their mission related objectives. So we're always appealing where it also need not be financial. Right. We appreciate support in even resources, in knowledge, because we're building a knowledge hub. We want to empower, we want to teach those communities, even expertise as well, you know, coaching even for us as entrepreneurs, exposing us to different tech platforms, because we're trying to incorporate tech in what we're doing. So we're really appealing to everyone there if there's any form of help where you could assist us, and it need not be financial.
That's very good. Yeah, that's beautiful. So how do people get in touch with you? Do you have a website? Do you have contact details?
Yes, we do have a website, which is www.mpilo mobile, mobile.co.za. So www.mpilomobile.co.za, or you can find us on Instagram under Mpilo Mobile, or they can also reach us out to us on our Facebook page, Mpilo Mobile, right, Adi?
Right,
yes. Or they can reach and Twitter.
Lovely. So if
or at mpilomobile.co.za.
So after this, if either of you could email me with all of those contact details, I'll make sure that they're on all of the social media marketing that I do for this episode. That they'll be on LinkedIn, they'll be on my website, on YouTube, on my Instagram. I'll make sure that all of those contact details for you get out as much as possible.
And something else, Paul, that's unique to our country. So we have what we call broad-based economic empowerment. And that is for the previously disadvantaged, where multinational companies are supposed to comply with giving a certain amount of business to triple BE companies that meet the criteria. So our company, being from an ownership perspective, being 100% Black owned, gets multinational companies those points that they need, which is almost mandatory and a statutory requirement to either have preferential supplies, you know, by giving certain aspect. And because of the work that we do, even if we can't be a normal supplier and we might not fit into, but you could support us, and that would help you meet your ESD needs or your skills development levy, where you get a tax rebate from supporting a business like ours.
Yeah, That's that's a really good detail to add there as well, because that might incentivize some businesses who are working in your area.
Yes, yeah. Thank you so much.
Hey, no problem. I would love to have you back on. Maybe a couple of months down the line, just to see how the projects are going, see if if this has made any sort of impact at all. I hope that it will. And if you need any information about technology or managing the projects using free online services, I'm more than happy to put a list of different links of free things together that can.
Yes, we appreciate that. We appreciate
no worries.
That would be
no
great.
Worries.
That would be great.
Yeah, it was. It's actually fantastic. Like to meet both of you. You've both been amazing, and to listen to your story of your startup has been absolutely fascinating and really interesting. And you really over the time that we've spoken, you really made me care about your organization and the work that you do. So I'm sure that there will be somebody out there when they listen to this that they will feel that as well. That this is a genuine endeavor that helps so many people in really simple but yet effective ways. And I think that that's really powerful. Like, you're not asking the world, you're just asking for to be able to network with people who might be able to help you out, so that you can give back to these communities and raise people out of poverty and to help people who are sick. There's no better cause, really, is there?
Yeah, no.
Lovely.
Thank you so much, Paul.
Hey,
thanks
my pleasure.
for the opportunity. Thanks for the opportunity to connect with you. I'll send you the links to the site. And if you can use that to promote what we're doing, and we hope to expand the business into lots more countries and hopefully make it an international brand where the model can be incorporated. Dream big, they say. I will spread it. I will tell I'll tell as many people. I'm doing an MBA right now, so I'm networked with a whole community of international people, business leaders and people who work in all sorts of different businesses. I think there's about 80,000 of us right now in this community. So I'll be able to post about that in that community, because because I'm an ambassador for my area. Okay. So I'll be able to. That's how I connected, because I'm also doing my MBA at the moment, so that's how I reached you.
Is that how you found me? Through the Power MBA. Nice, right? I thought it was. Yeah. So I'll advertise it in there as well, and that's where we'll get.
That would be wonderful.
We'll get those connections.
It would be great to reach out to you.
Are you enjoying the program?
Actually, I am, but I'm a bit behind.
Me too.
My studies.
Me too. Yeah, definitely. I am as well. Life gets crazy, and it's so easy to fall behind. But cool. So
as an ambassador has quite a influence in their communities that they.
I hope so. I hope so.
And Paul, we're also very open, to some of the MBA candidates with their research topics, because in our space we have access to a lot of data. So at some point we actually did get a grant from Pfizer, and even some of the other pharmaceutical or any other research entities, right? Because we're able to pick up data and statistics, even through our COVID testing. So I'm always open to helping, any academics who are on a different research topic and who we might have access to the information that they need, simply because we serve such a diverse array of communities, different LSMs, different topics as well, social ills, people's spending habits, behavioral science. That's data that actually, on a secondary level, we have access to the work that we do. So I'm more than happy to help.
That's fascinating as well. Yeah. Wow, are you allowed to share that? Are you allowed to share that data?
Yeah. So the only thing that we have a restriction is sharing names and surnames.
Okay,
but there's no restriction in sharing numbers.
Awesome. Yeah.
Yeah.
fantastic. That's a great resource.
Or insights as well, because we also pick up insights on the grads. Absolutely nothing wrong with sharing insights as well.
Wow. Okay. Fantastic. Yeah. So thank you so much for your time and for coming on the podcast. I really appreciate both of you, and it's been my absolute pleasure to spend this evening speaking with both of you. Thank you so much.
Thanks for all the best.
Thanks for the time. Thank you for.
See you later, ladies. Bye.
Cheers. Bye. Bye.